Good evening everyone and welcome to another edition of Ask Max Expert live session. Today we have Dr. Vikas Goswami, Senior Director Medical Oncology at Max Super Speciality Hospital, Vaishali. Dr. Goswami specializes in gastrointestinal and hepatobiliary cancer, lung cancer, breast cancer, head and neck cancers and many more. Today he will share expert insights on why cancer isn't one disease and how personalized oncology is transforming patient outcomes. So doctor, over to you.
Thank you. One of the most common things my patients ask me is, let's presume कि सर मेरा ब्रेस्ट कैंसर का ट्रीटमेंट ये चल रहा है और हमारे पड़ोसी को भी ब्रेस्ट कैंसर है, उनका ट्रीटमेंट तो कुछ और चल रहा है, तो ये दो ट्रीटमेंट अलग क्यों हैं? वेल, दिस इज़ द प्रिसाइज टॉपिक ऑफ दिस सेशन कि दो ब्रेस्ट कैंसर या दो लंग कैंसर सेम होते हुए भी कैसे अलग हैं, कैसे आज के एरा में हम लोग दो सेम कैंसर्स के ट्रीटमेंट अलग हो सकते हैं और अलग होने चाहिए बेस्ड अपॉन देयर डीएनए, बेस्ड अपॉन देयर पेशेंट्स एज, based upon patient's tolerance and very importantly based upon protein expression जिसको हम कहते हैं receptor expression. So इस personalization को बोलते हैं precision medicine. So cancer treatment today is about precision based upon the individual variances in the cancer expression. I am Dr. Vikas Goswami and I look into all this and decide what is the personalized treatment for the patients based upon these very variations. Cancer जो है, whether it is lung cancer or breast cancer or GI cancer and so many others, first of all, in olden days we used to divide into not only the stage का मतलब कि ये कितना फैला हुआ है, बहुत छोटा सा है तो उसको early stage बोलते हैं, अगर पूरे शरीर में फैल गया है तो उसको एडवांस्ड कैंसर बोलते हैं, और इसके बीच में है यानी कि बहुत छोटा है या पूरे शरीर में फैल गया है, इसके बीच को हम लोकली एडवांस्ड कैंसर कहते हैं. सो यूजली जो पर्सनलाइजेशंस होती हैं स्टेज 4 यानी कि एडवांस्ड कैंसर्स में बहुत ज़्यादा कॉमन है और अर्ली स्टेज में भी बहुत सारे कैंसर्स में इनको किया जाता है. ये पर्सनलाइजेशंस जो हैं यूजली डिपेंड करता है कुछ टेस्ट्स पे. पर्सनलाइजेशन का मतलब कि कौन से व्यक्ति को क्या ट्रीटमेंट जाएगा, ना केवल इस चीज़ पे डिपेंड करता है कि उसको कैंसर किस टाइप का है, बट कुछ टेस्ट पे उस टेस्ट को रन किया जाता है ऑन द बायोप्सी सैम्पल. अब ये बायोप्सी सैम्पल जो है वो टिश्यू का भी हो सकता है या ब्लड भी हो सकता है. ब्लड को हम लोग बोलते हैं लिक्विड बायोप्सी और टिश्यू को हम लोग बोलते हैं सॉलिड बायोप्सी. ये जो टेस्ट होते हैं ये कई प्रकार के टेस्ट होते हैं. कुछ टेस्ट को हम बोलते हैं IHC टेस्ट. IHC टेस्ट टिश्यू पे किया जाता है और कुछ दूसरे टाइप के टेस्ट हैं उनको हम लोग बोलते हैं NGS टेस्ट. तो whether this is IHC or NGS, based upon these the cancer is differentiated. Same cancer can be differentiated into various subtypes, various डिविजन्स आर देयर. फॉर एग्जांपल ब्रेस्ट कैंसर का पेशेंट स्टेज 4 का आज ही हमने देखा, एक दूसरे कंट्री से लेडी आई थी, तो उनको हम लोगों ने कहा आपको स्टेज 4 का कैंसर है और इवेंचुअली वी ओनली एडवाइज हर सम टैबलेट्स. हर क्वेश्चन वाज दैट आई हैव ट्रैवल्ड ऑल द वे फ्रॉम फिजी एंड आई हैव अ स्टेज 4 कैंसर एंड द ओनली ट्रीटमेंट यू आर टेलिंग मी इज टैबलेट्स. दैट्स टू सिंपल. But the reality is that based upon her molecular subprofiling, she only requires tablets. Similarly, there is another patient who's a breast cancer and she may not at all respond to tablets. So the point is that same cancer, same age may have different treatments.
Thank you doctor for your insights. We have a couple of questions coming in from the audience that shall be taken up one by one. So the first question is, we often hear cancer used as one word. What actually makes cancer so different from each other?
Cancer is different because the driving mutation is different. For example, in lung cancer, the word is lung cancer, but it can be because of various reasons. Those reasons are because of changes in DNA. This change in DNA is called as mutation. So DNA is like a very big structure. For example, a gene is like a house. Now the house may have leakage of water because of that leakage in room number 1, room number 2, room number 3, room number 4. Similarly, so different leakages, different treatments. Similarly, for genetic variation, different type of variations, which we called as mutations, can cause the same endpoint called as cancer. So as I was giving an example of lung cancer, same lung cancer can be because of different cause. That cause is called as driver mutation. So same cancer can be because of different driver mutation, and based upon the driver mutation the treatment is different. That's why same cancer is not the same cancer, it's different cancer based upon a different cause, which is called as a driver mutation.
The next question we have, what exactly does personalized oncology mean for a patient? How is it different from traditional treatment?
Traditional treatment means treating a cancer based upon just the stage, whether it is stage 1, 2, 3, 4. It's a mechanical way of treating. Treat stage 1 in a particular manner, 2 in a particular manner, 3 in a particular manner, 4 in a particular manner, and all 4 cancers are grouped together. So what are we measuring? We are only measuring the anatomical locations and the size of the tumor. However, in the 21st century, the era has changed and we are now into the era called as precision medicine. As I said before, precision medicine not only looks at the anatomical and the physical locations of the tumor, it also takes into consideration the cause of the tumor. So the based upon cause, the treatment varies. So how does it play out? Like I showed you, like I told you, 2 neighbors, same cancer, same stage, everything same, can have completely different treatment because they have different DNA mutations and therefore different treatments. Somebody may be taking just chemotherapy, somebody may be taking chemotherapy plus targeted therapies, somebody may be taking only targeted therapies, somebody may be taking only tablets. So my advice to people is that whenever you start matching the treatments on WhatsApp or discussions as a casual part of household gossip, don't just simply look at the cancer name and the cancer treatment. Also try to understand what are the causes of that cancer and why the treatment is different.
The next question we have, does personalized treatment depend more on the cancer type or the patient's own body?
Personalized treatment basically means which is specific or tailorized to the person. So obviously it depends upon 2 things, the person type. If one person is very frail, second person is absolutely fit, same age, same cancer, the treatments will vary. Second is the cancer type. 2 people may have absolutely same age, same type of cancer, same health, but different cause, they will have different treatments. So personalized takes into consideration not only the subtype of cancer but the cause of cancer and the health of the patient as well.
The next question in line is, does personalized treatment improve survival rates or is it more about quality of life?
It's about both. A cancer patient, you cannot give a choice that either choose quality of life or choose survival rate. First option is always survival rate and quality of life both. If you can't improve the survival beyond a point, then comes quality of life alone. And personalized treatment makes a huge difference in both. Survivals are increasing. Just to give you an example, a small, very small example, there's a disease called as CML. About 25 years back, CML was a death sentence. Patients would be treated with chemotherapies and would not survive more than a year. And today, CML patient is like diabetes. He just has to take 1 tablet and he goes on and on and on for decades. The treatment is even lesser than diabetes. Even a diabetic patient takes multiple medicines. So here not only survival is increasing but also the quality of life.
Thank you, doctor. The next question we have, for patients, does this approach reduce unnecessary side effects compared to conventional therapies?
Absolutely. Uh, Personalized medicines have practically a fraction of the side effects as compared to chemotherapies. The logic is that chemotherapies kill both the cancerous cells and also damage the good cells of the body, and therefore they cause side effects. While personalized treatments called as targeted therapies are specifically designed to attack only the cancer cells and thereby sparing the normal cells or the good cells of the body. Therefore, the side effect of the personalized treatments are a fraction. Patients can easily continue with their life, they can do their work, they can enjoy their lifestyle and continue with these treatments for long. So that's the biggest benefit of personalized treatment.
On to the next question. How long does it usually take to create a personalized treatment plan? Does it delay the treatment?
No, with the latest kind of tests which are available in all big hospitals, tertiary care hospitals, usually the reports come as early as 48 hours to up to 2 to 3 weeks. So we are not really actually delayed in searching for a treatment of personalized medicine, and if the patient is too sick for even waiting for 48 hours, we start with generalized treatment, simultaneously send those tests and wait for the results. So while theoretically it does make a delay, but the delay is not more than 2 days to maybe 2 weeks.
On to the next question. How do multidisciplinary teams work together in a personalized cancer care?
Multidisciplinary teams are a backbone of personalized cancer care because cancer care is not about one person deciding what to do. What are those teams? First of all, we need to know those. Apart from the medical oncology, there are surgical oncology, radiation oncology. Then there is a whole team of pathologists and nuclear medicine experts, very importantly interventional experts. All those combined decide the best sequence of treatment, because a treatment is not just one episode happening, it's a process. It's a process whereby multiple departments collaborate and decide what is best. Just to give you an example, a patient of colon cancer with lung mets or colon cancer with liver mets can undergo chemotherapy first, followed by surgery, can undergo surgery first, followed by chemotherapy, can undergo no chemotherapy at all, only targeted therapies, can undergo targeted therapies plus radiotherapies. Now there are 4 options I just enumerated. There can be more. Which one to decide, how to decide, what is the best first line of treatment? This is the precise backbone of the treatment, because that is what decides the survival and the longevity and the quality of life. So this decision is taken together in a meeting called as tumor board. So multidisciplinary team basically comes together on a platform called as tumor board, and there they decide the best and optimal sequence, and that's how it should be. A 80-year-old person may have a different treatment from a 60-year-old person. So how to decide? No one person can decide. All the stakeholders have to be together to make a decision. So personalized medicine plus personalized care by a multidisciplinary team. That is how cancer treatment is shaped.
Thank you, doctor. The next question in line we have, can personalized treatment help patients who didn't respond well to earlier therapies?
Of course, yes. So many times we see patients coming from tier 2, tier 3 cities with failure of frontline treatment, and the best armamentarium is search for the cause and treat the cause. So very importantly, yes, they are a very important backbone of treatment, especially for patients who have failed first or 2 lines. I'll give you an example. I saw a patient, she was CA colon with brain mets. She had failed 2 lines of therapy in some other hospital, had come to us for just an opinion, and we ran some tests and we found that she would be a perfect candidate for immunotherapy. So only yesterday she completed 2 years of immunotherapy and we have stopped it. So imagine when she came for the first time and she was being told that the treatments have exhausted and she may not have more than 3 months to survive. From that day to today, where we have stopped immunotherapy after 2 years because she is absolutely treatment free. So personalized care medicines do make an impact in all lines of therapy, and if you ask me specifically, first or second line treatment failure, yes, but the key lies in searching for the cause. I want to warn you that it's not that in every case we are able to search for a cause, but it's very, very imperative to search for a cause at all stages and all cases.
There are some other questions coming in from the audience as well. Taking up the next, is this approach available widely in India or only at selected cancer centers?
As of now, it's available at most of the tertiary care hospitals, certainly not available at smaller or lesser hospitals because of various reasons. One is infrastructure, second is equipment, third is lack of multidisciplinary team at the same time. At smaller places, a pathologist, a radiation oncologist, a surgical oncologist, maybe an interventional gastroenterologist, gastrosurgeon may not be available at the same time. But with the increasing infrastructure, things are improving in India, and in the coming years I am very sure that it will be available even at smaller places.
The next question we have, what misconceptions do patients usually have when they hear personalized cancer treatment?
Personalized cancer treatment can have so many misconceptions, and all those misconceptions come in the form of advertisements on YouTube or WhatsApp. I know so many of them without naming. People use the word personalized care, targeted therapies in a very generic form. There are advertisements, very glossy brochures. But remember one thing, that I am using the word personalized medicine just to make it easy. It's a very complex science, and the treatments are available only at bigger hospitals. If you ever find that word personalized care being advertised like a magazine advertisement, do check the credentials of the treating doctors. They should be adequately qualified, because I am aware that a lot of parallel modalities of treatment are also being pushed under the name of personalized care, and most of them are fake. If I am offering a personalized medicine, let's say in Max, it is a proper treatment if the same kind of advice is being given in other hospitals, let's say AIMS or Tata Memorial or even abroad. That means the science cannot change. The treatments will be the same across the hospital. However, if I am advertising something in the name of personalized medicine, which is available only at my center, and I claim that I am the one who have devised it, and it is available nowhere else, then it is 100% fake and quackery. The term personalized medicine is a generic term. These kind of treatments are available everywhere at big cancer centers, but beware that such kind of glossy terms are being used even by quacks.
Taking up the last question of the live session, what is the one thing patients or families should ask their doctors about personalized cancer care?
So if your doctor is adequately qualified, they would be anyway ensuring that the treatment are as per guidelines. It's not a mystery that, oh, I need personalized care. Everybody who's into the healthcare system and is into a big system is going to follow these. These are very specifically treatments laid down by very neat guidelines by the government. But still, if you are curious to know, try to understand the treatment details from your doctor. You will find that your medical oncologist or surgical oncologist is more often than not using those terms, and if not, then you can ask specifically in a simple way, sir, are there any targeted therapies available for my patient? Rather than using the word personalized medicine, ask this specific line, sir, are there any targeted therapies available for my patient? your doctor will immediately explain you in detail what all options are there for you.
Thank you very much, Dr. Goswami, for your valuable insights and precious time today. Please share a concluding message that you would want to pass on to our audience.
My concluding message is that in the today's era, please don't be scared of the word cancer. I know it's easier said than done, but if anybody in your family or your near and dear ones are suffering from a disease called cancer, trust me, there are very good treatments available which not only can cure the cancer in early stages, but even in advanced cases. The treatments are such that the patient, even if he is elderly or frail, will be able to take more often than not easily. Thank you.
Winding up the live session here, thank you audience for joining today.
My pleasure. Thank you.